Welcome to the deep dive. Today, we're diving into something incredibly important, something that really touches almost all of us, healthcare quality and patient safety. But we're looking at it through a pretty specific lens. You know, that moment when formal care shifts and a loved one comes home from the hospital. How can families possibly feel ready for that transition?
It's such a critical handoff, isn't it? You've got the family suddenly needing to manage potentially complex care.
Right.
And then on the other side, you have the whole healthcare system trying or needing to deliver the highest standards right from the start.
Exactly. So our mission for this deep dive, really pulling from the sources we looked at, is to explore both sides. You know, the practical, maybe even messy reality of family aftercare.
Yeah, the day-to-day.
And then the bigger picture. How do hospitals and these large systems work to build quality and safety into their very foundations? Things like accreditation, for instance.
And how do those pieces fit together? Or sometimes maybe they don't fit quite as seamlessly as we'd hope.
That's the key question. What does that connection or lack of connection mean for someone actually recovering?
Okay, so let's unpack it. The reality is, just like you said, recovery definitely doesn't stop when you leave the hospital.
Not at all.
It moves home. And, well, the weight of that often falls squarely on family members who suddenly are caregivers.
And the sources we reviewed really hammered this point home. One piece pointed out something quite staggering. 40% of caregivers said they received basically no training for aftercare before discharge.
40%. That's an alarming number.
It really is.
Especially when you think about the impact. Good aftercare isn't just about, feeling less stressed. It's absolutely vital for preventing complications.
Right.
Making sure the recovery goes smoothly and, critically, lowering the chances of needing to go back to the hospital.
And the potential impact is huge. The material suggested that proper aftercare can cut hospital readmissions by as much as 25%.
25%?
Yeah.
Just from better aftercare support and knowledge?
It feels like a massive lever we're not always pulling effectively. It just highlights how crucial that family unit becomes.
There's suddenly the frontline support, right? The 24/7 team isn't there anymore.
Exactly. So the goal, really, as the sources stress, must be about empowering those families, giving them the knowledge, the skills, the confidence they need.
Okay, so what is that essential information? What do families absolutely have to walk out that door knowing? The sources laid out several key areas.
First up, and it sounds basic, but a really clear understanding of the patient's actual condition. The diagnosis, sure, but also what it means for daily life, what the overall treatment plan looks like.
Getting that basic context. Step one.
Then, medications. Oh boy, this is where it can get complicated fast. Families need to know the purpose of every single medication, the exact dose, the timing, potential side effects, and crucially, the right way to give it. Mistakes here are just too common and potentially dangerous. And then there's all the practical stuff, right? The post-discharge management, things like how to care for a wound, any special dietary rules, what kind of exercise is okay or needed.
Any special equipment maybe, or activities they need to do or avoid. It's all the daily care that professionals were handling just hours before.
Yeah. And maybe most importantly, the sources really stress knowing when and how to get help.
Absolutely critical.
Families need to be taught the specific warning signs. What signals that something's going wrong? And then who do they call? Where do they go if they see those signs?
We even saw a kind of warning signs cheat sheet idea in the materials. It made a clear distinction between the really urgent signs, the go to the ER right now things.
Like blue lips or seizure activity, or if the person is unresponsive. Scary stuff.
Definitely. Versus the signs that mean, okay, call the doctor within 24 hours. Maybe a fever over 100.4 or some new swelling or sudden confusion.
Having that clear guidance seems like it would take away so much panic and guesswork, helping families make the right call quickly.
It empowers them to act appropriately.
Okay, so that's the what, the crucial info families need. But thinking about that stressful discharge moment, families juggling so much, how do hospitals and care teams actually teach all this effectively? How do we bridge that gap we talked about, that 40% getting no training? It can't just be a stack of papers.
No, absolutely not. And this is where the how becomes just as vital as the what. The sources really push for communication that is, well, clear, simple language, actively avoiding all that medical jargon.
Yeah, jargon is a killer.
And using visual aids. Things like charts or diagrams can make complex information much easier to grasp.
And it's got to be a two-way street, right? The sources mentioned active listening, the doctor or nurse really listening to the family's questions, their concerns, making sure they feel heard.
Definitely. But what really stood out was the emphasis on verifying understanding, not just dumping information. That teach-back method was presented as absolutely critical.
Right, teach back. It's not just asking any questions or do you understand?
No, it's asking the caregiver to actually explain it back in their own words. Or even better, demonstrate a task.
The material gave examples like asking, okay, can you show me how you'd give mom this pill at noon?
Or, what would you do if you noticed Dad suddenly seemed short of breath?
And the key is gently correcting any misunderstandings right then and there during that teach back.
Exactly. It ensures the knowledge actually transferred. It's not just on the provider's checklist, it's in the family's understanding and ability. It's almost like a quality check on the communication itself.
Which, you could argue, should be part of any hospital's quality standard, right?
You'd think so.
Beyond just communication techniques, the sources got into some really practical tools and training ideas.
Yeah, simple things even, like using a 7-day pill organizer, setting phone alarms but labeling them with the drug name.
Oh, that's smart.
Using checklists for daily tasks or keeping a little log of symptoms or vital signs. Basic, but effective.
And hands-on practice where possible. I liked the suggestion of using, like, a stuffed animal to practice wound care.
Or getting a real demonstration of how to safely transfer someone, maybe from the bed to a chair. That physical skill is crucial.
They even mentioned role-playing, calling 911, practicing having the key info ready, like, my husband had surgery on Tuesday and now he's having trouble breathing. That kind of prep could make a huge difference in a real emergency.
These are really concrete ways the system can help empower families and build that confidence.
Which is so important because caring for someone at home, it's not just physical work, it's emotionally draining too.
Hugely. And the sources definitely address that, emphasizing the need to support the caregiver themselves.
Yeah, offering emotional support, pointing them towards resources. There's this phrase, emotional first aid.
I like that. It just means validating their feelings.
Yeah.
Simply saying, look, it's okay to feel overwhelmed. It's okay to be frustrated. This is really hard work. That acknowledgement can mean a lot.
And the classic reminder about self-care. You know, you can't pour from an empty cup. Try to take even just 10-minute breaks. Simple, but easy to forget in the moment.
And also, being vigilant, watching for signs of anxiety or depression, not just in the patient, but in the caregiver too. And knowing it's okay to seek professional help for that.
Definitely. Plus, knowing when it's time to call for backup.
Right. Like if the patient falls or the caregiver is just hitting a wall, totally exhausted, or if something like a wound just doesn't look right.
And the sources mentioned checking what resources the hospital might offer after discharge, maybe referrals for visiting nurses, or do they have a 247 discharge hotline families can call with questions?
Those can be lifelines.
There was even a quick mention of something called a family aftercare agreement, like a way for families to maybe structure who's doing what, which, again, feels like something the hospital could potentially suggest or facilitate.
It really shows the level of detail that might be needed for truly effective family support.
It does. Okay, so we've spent a good chunk of time on the family side, the needs, the information, the support. But let's pivot now. How does the healthcare system itself try to ensure it's built on a foundation of quality and safety to begin with, to enable that good handoff we talked about?
Right. And this is where healthcare accreditation really comes into the picture as a major mechanism.
The sources highlighted organizations like Joint Commission International, JCI. They were presented as a pretty major global leader in setting and affirming high standards for healthcare quality and patient safety.
Yeah, their mission statement is quite powerful: to enable and affirm the highest standards of healthcare quality and patient safety for all.
And their reach is significant, working in, over 70 countries, accrediting and certifying thousands of programs.
Supported by hundreds of experts. So what they provide are these really rigorous international standards. That includes specific things like the International Patient Safety Goals.
And they offer different accreditation and certification programs, right, for specific types of clinical care, but also the sources mention newer ones looking at healthcare sustainability and even telehealth.
Which shows how these standards have to evolve with healthcare itself.
Absolutely. And getting accredited, it's not just about getting a certificate for the wall, is it?
Not at all. The testimonials in the materials pointed to real, tangible benefits. Things like better teamwork inside the hospital, maybe a competitive edge, definitely increased trust from the community.
Better risk management too, I imagine.
Yes, and maybe the most crucial outcome: helping to create and sustain a genuine culture of patient safety among all the staff.
It sounds like JCI provides a framework, a roadmap for hospitals to constantly look at themselves and improve how they operate.
And the sources also mention newer models, like patient safety pathways and JCI Continuous, suggesting a shift towards more ongoing monitoring and improvement, not just, a big inspection every few years.
Okay, so that's the international picture. But this push for standards isn't only global. The material also brought up the National Accreditation Board for Hospitals and Healthcare Providers, NABH, as an example specifically in India.
Right, operating under the Quality Council of India.
So NABH's role sounds similar to JCI's, but focused domestically within India, establishing and running accreditation programs, setting benchmarks tailored for their healthcare context.
Exactly. Their stated goal is creating an ecosystem for quality within India. It just demonstrates that this drive for high standards and frameworks to achieve them is happening at multiple levels, international and national.
Okay, so we have these bodies, like JCI and NABH, defining what quality healthcare should look like. But hospitals themselves are incredibly complex organizations. Who helps them actually do the work to meet these demanding standards and, frankly, just run smoothly day to day?
That's a great point. And that's where support services for the whole healthcare ecosystem come in. The sources gave an example of a firm, Supremedic Consultancy, that specifically works to help hospitals achieve and maintain that level of quality.
And the services they offer seem to tie directly back to building that high-quality system we're talking about. Everything from the initial planning and design of a hospital
to making sure they have the right medical equipment, recruiting the right staff.
And crucially, the material highlighted their work in implementing quality management systems.
Which, put simply, are the formal processes a hospital uses to ensure consistency, reduce errors, and ultimately improve patient care and safety.
And they specifically mention helping hospitals navigate that NABH accreditation process we just discussed.
Exactly. So companies like this are essentially partners, helping hospitals build the internal structures and processes needed to meet those high accreditation standards, which hopefully leads to a safer environment for patients.
Makes sense.
And then when you look at platforms like HospiMatch, which was also mentioned briefly, it gives you a sense of just the sheer breadth of complex topics that healthcare organizations have to manage well. Everything from chronic disease management, new patient care trends, specialized surgeries, complex imaging tech.
It's a huge landscape. And accreditation and effective aftercare have to somehow function across all of that complexity.
Precisely.
Okay, let's try and bring this all back together then. We've talked quite a bit about the essential, very practical needs of families who are supporting someone's recovery at home.
Right. The information they need, the teaching methods like TeachBack, the tools, the support for the caregivers themselves.
And then we also explored how the bigger healthcare system tries to build that foundation of quality and safety, mainly through accreditation bodies like JCI and NABH, and also the support services that help hospitals get there.
And I think the really clear takeaway weaving through all the sources is that achieving the best quality, the safest outcomes, it's fundamentally a partnership.
Yeah, that word came up a lot.
It absolutely requires robust, well-structured, accredited systems inside the hospital walls. But just as importantly, it requires those systems to effectively inform and empower the people, the families who carry that care forward once the patient goes home.
One of the sources put it really nicely, I thought. In patient aftercare, family knowledge and teamwork are just as critical as medicine. Together, you build a safer, smoother path to recovery.
That really captures it. Another one phrased it simply: a well-informed family is a patient's strongest healing ally.
It underscores that the best results happen when the professional system and the family support system are both strong, both prepared, and crucially, communicating and collaborating well.
Absolutely.
So maybe here's a final thought for you, our listener, to mull over after this deep dive. Healthcare quality isn't just this passive thing that happens to a patient while they're confined to a hospital bed. It seems it's actively co-created. It's built through the actions of every single professional caregiver, yes, but also through the strength and the design of the underlying systems and standards.
And crucially.
And through the knowledge, the preparation, and the empowered participation of families and all the support structures around the patient. So the question becomes, what role might you play as a patient, as a family member, just as someone interacting with the system in recognizing and maybe even strengthening that vital partnership?